Welcome to day 4 of the Sri Lohana Association Birmingham. We are sharing some health tips with all the viewers on Facebook. My name is Dr. Lalit Sodha. I'm a doctor of chiropractic, and today's topic is discussing on a very popular topic on bone health and osteoporosis. Yeah? So let's first of all discuss what causes bones to deteriorate, or the bone health not to be sufficient. Number 1, lack of calcium. That's the biggest one. Lack of calcium and lack of vitamin D. Those are the two essential nutrients. Eating disorders can do it. Severe diets can do it. When you start eliminating a lot of food products from your intake, that can really cause a harmful effect. So watch what diet you're taking. Medical conditions like asthma, especially when you're under a lot of steroid type of treatment, or any steroid treatment that you're having, it's going to directly impact your bone density. So that's going to affect your bone health to a great extent. And as I said, for any other conditions where there is a lot of steroids being administered, that bone health is definitely at risk. So one must absolutely get it checked. So let's also find out the 3 most common bones that are affected with osteoporosis or thinning of the bones. Number 1 is the wrist bones, number 2 is the hip bone, and number 3 is the spine. Okay? All the other bones can get affected, but these are the 3 top ones that do get affected when osteoporosis sets in. When osteoporosis sets in, there's 2 things happening. The body does not make enough new bone, or the bones that are already there are being reabsorbed at a higher rate. Generally, when you have osteoporosis, you have a combination of both. The body not making enough, and whatever is there is being reabsorbed faster. Okay? So very important to get it tested, get it checked as we approach the criteria, which I will discuss in just a minute or two. The simplest test we can do is that of a bone density, and it's called a bone density scan. That is something that as the lockdown opens up and you feel if you're vulnerable, then that's something that you can discuss with your health practitioner, talk to them, get some good advice, and see if a test is necessary. Some of the early signs of osteoporosis or thinning of the bones, I'm afraid there are no early signs, but some of the signs that will come up is the first time you realize when you fall and you break your bone, you're young, and you think, oh, that wasn't a heavy fall, and I broke my bone. Well, let's check it out. They'll definitely do an x-ray, maybe a bone density scan to find that out. Also, a fracture of unknown origin that comes up even without trauma is something that we should look into. Bones in your spine can collapse, the vertebrae can collapse. That's also an early sign of osteoporosis setting in. The other very common thing, a lot of people say as we age, our height is decreasing. Well, let's find out why. When bones thin, the height decreases. So that's a big check to check at home if your height is decreasing. Now, some of the risk factors for osteoporosis, let's note that down. There is the female gender, especially the females 50 plus, fair-skinned. Those are the 3 F's for risk factors for osteoporosis. Female, 40 plus or 50 plus, and fair skin. So, and if there is family history of it. Okay, so there is that needs to be looked into. Asians, Caucasian background, ethnic races are also a little bit more susceptible to osteoporosis. Surprise, surprise, cigarette smokers. Increased alcohol intake. So alcoholics, cigarette smokers, hey guys, watch it. You have a higher risk of bones deteriorating quicker. Lack of exercise is another big one. If you don't use it, you lose it. Improper diet and nutrition. Absolutely important. What you eat is what you are. So get the food diet checked properly and make sure there's enough exercise that you're doing. Last but not the least, particularly the females, is the hormonal change. When you're approaching menopausal years, definitely the bone density gets affected at that point in time. We've discussed the common causes of it, what happens during osteoporosis, What are the risk factors? Now, how do we treat it? Treating osteoporosis is actually a lot can be done at home, and if it needs medical intervention, that's after the tests are done. Treating osteoporosis or managing the condition, the biggest one I'm going to suggest, number one, is weight-bearing exercises. As good as walking would be good. Get the blood tests done, bone density scan done to identify what the bone density is. Get supplements with calcium and vitamin D that will absolutely have a good source of your bone, and also a very balanced diet. Quit smoking, and the other one, on a sunny day, make sure you get enough sunlight. The foods that are rich in vitamin D and calcium, some of them I'm going to name: spinach, kale, soybeans, soy milk, cheese are healthy products to eat. Almonds, tomatoes are also good sources of calcium. Today we have discussed what causes osteoporosis or thinning of the bones, what are the risk factors, what are the signs and symptoms, and how we can manage it at home. This is general advice given on the Sri Lohana Association Birmingham Facebook page. If you need any further information, do not hesitate to contact us. My name is Dr. Lalit Sodha. I'm a doctor of chiropractic. Thank you, Sri Lohana Association of Birmingham.